Hello and welcome to my informational video on the top 14 symptoms of liver damage that you critically need to know about. As your liver is responsible for over 500 absolutely vital functions in your body, any degree of damage to this crucial organ can have widespread and devastating effects on your overall health and well-being. That's why recognizing the telltale signs of impending liver disease early on is so unbelievably important for safeguarding your health. In this hopefully helpful and engaging video, I'll be delving deep into the most common yet often overlooked symptoms that may indicate your liver is becoming progressively damaged or diseased. Understanding these critical warning signs can empower you to seek the right medical testing and life-saving treatment before further complications have a chance to arise. So let's dive right in and explore the top 14 vital symptoms of liver damage that you must know about. When your liver is severely struggling and not functioning up to speed, it has a much harder time properly metabolizing dietary fats and proteins. This vital function is also known as digestion. Over time, impaired digestion can lead to inadequate production of stomach bile and difficulty breaking down and absorbing nutritious fatty foods. As a dangerous result, people with increasing liver damage often lose their appetite entirely, feel painfully nauseous after eating, or don't derive pleasure from eating once enjoyable foods high in fat and protein. Progressing liver issues stemming from disease or prolonged alcohol overconsumption can cause a wide array of visible warning signs to appear right on your skin over time. Some common skin changes to watch out for include prominent spider veins on the face, hands, and legs, blotchy skin reddening on the palms and feet, and jaundice or yellowish discoloration of the skin indicating a dangerous buildup of bilirubin in the bloodstream. These skin changes emerge due to hormonal shifts in the body, vitamin and nutrient deficiencies, systematically increased blood vessel pressure, or most often, the liver's failing ability to properly filter and purge waste products like bilirubin from the bloodstream. When the liver becomes overburdened and increasingly damaged over the years, it is forced to work much harder just to perform its most vital functions for sustaining life and health. This persistent overexertion taxes the liver more and more over time, and progressively leaves the affected person constantly tired, mentally drained, and with impaired focus and clarity. Later down the line, this cascading causality can ultimately progress into brain fogginess, memory loss, confusion, coma, and even full liver failure or cancer stemming from years of unchecked hepatic encephalopathy. The wide-ranging physical and mental discomfort arising from advancing liver disease and the associated symptoms like painful abdomen swelling and cramping puts extraordinary physical strain on the body that ends up severely disrupting normal sleep cycles and prevents the body from fully resting and recharging. As liver disease enters into its later and more dangerous stages with fewer treatment options available, it also sparks dramatic chemical changes in the brain that further destroy quality sleep. This perpetual cycle of poor restful sleep and declining health can quickly spiral out of control. When the liver isn't working properly or becomes severely diseased over time, it triggers a process known as malnutrition in the body, which can become deadly over time if left untreated. In the early stages of malnutrition stemming from liver dysfunction, poor appetite, nausea after eating, and rapid unexplained weight loss are often the first noticeable symptoms. But left unchecked, those with liver cirrhosis additionally experience muscle wasting at rate 10 times faster than normal during routine overnight fasting or skipped meals. This leads to chronic fatigue, loss of strength, and reduced immunity. As cirrhosis fully sets in after years of chronic untreated liver disease, it causes a dangerous accumulation of fluid in the abdomen known medically as ascites. This abnormal fluid buildup in the abdomen combined with increased systemic blood pressure, placing immense strain on the blood vessels supplying the liver, puts substantial and often debilitating pressure on the surrounding abdominal tissues. This frequently leads to pronounced abdominal swelling and cramping, nausea, vomiting, and greatly reduced appetite. Dangerous weight loss. Itchy, irritated skin with no rash or skin lesions is another classic indicator of advancing liver dysfunction, typically stemming from liver diseases such as hepatitis or certain autoimmune disorders. This moderate to severe itchiness sensation, known medically as pruritus, results primarily from increasing the restriction or complete stoppage of the flow of bile from the liver to the gallbladder. And because healthy bile flow plays such a pivotal role in the breakdown and absorption of dietary fats and toxins, its impairment or absence severely disrupts this entire bodily process. Over months or years, This leads to a dangerous accumulation of toxins, bile, and bilirubin internally, which then leaks out through the skin, resulting in agonizing, hard-to-control full-body itching that keeps you up at night and may require medical intervention to control long-term. When liver function becomes severely compromised from disease, digestion changes like chronic constipation or loose watery diarrhea soon follow. Why does this happen? Because a healthy liver and associated bile production play a starring role in ensuring you smoothly digest, break down, and absorb the nutrition your body requires to operate at peak efficiency. When liver problems arise over time, however, overall digestion slows down, giving the body more time to try and expel toxins through bowel movements versus proper metabolic absorption. Left untreated, constipation, diarrhea, and pale, clay-colored stool can become a regular issue, making eating properly nearly impossible. Odd urine color changes should never be ignored, as they frequently signal bigger unseen health issues are brewing behind the scenes. In relation to liver health, for example, amber, dark brown, or tea-colored urine is often one of the first visible signs that excess bilirubin, a yellowish digestive waste pigment normally broken down and excreted out through stool, is abnormally elevating. This happens when a diseased or heavily damaged liver simply cannot properly metabolize and filter out bilirubin fast enough. So instead, excess bilirubin bypasses bowel elimination and gets directly shunted through the kidneys and excreted through urine instead, tinting it a darker color in the process. So if you suddenly notice unusual urine color changes setting in for more than a day or two with no explanation, take it as a must-investigate warning sign to get your liver checked. Another key responsibility of a healthy, functioning liver is to produce essential proteins that enable your blood to properly clot whenever necessary to avoid excess blood loss from injury sites. However, when the liver becomes increasingly damaged due to disease, it struggles immensely to generate enough of these vital blood-clotting compounds. As a result, both ugly, unexplained bruising and bleeding excessively from minor cuts, scrapes, or injuries becomes much more prevalent and lasts longer before clotting. People may also experience frequent or heavy nosebleeds and bleeding gums when brushing as lesser-known symptoms something is seriously wrong. Moreover, existing varicose veins have a higher probability of rupturing, causing internal localized bleeding that may require emergency medical intervention. So easy bruising or bleeding you didn't have previously is always worth getting examined. Seemingly minor lower leg or ankle swelling can also indicate liver dysfunction is disrupting internal protein production and fluid balance. This emerging issue arises because your liver is responsible for producing key proteins that help maintain oncotic pressure balance between fluids held inside blood vessels versus outside surrounding tissues. But when liver damage occurs, it lowers protein production and allows fluids meant to stay inside vessels to start leaking outward into tissues instead. And because of gravity's constant pull downwards on our bodies, accumulating excess fluid due to liver disease usually first appears visibly as puffy ankles or feet before progressing upwards in later term stages. If swelling emerges and persists even after long periods of rest, it warrants further examination. Your fingernails and toenails act like canaries in a coal mine when it comes to revealing certain underlying health issues, and declining liver function is no exception. In fact, multiple types of liver disease produce an array of visible nail changes over time, including fungal infections, thickened nails, white streaks, excessive ridges, brittleness and breakage, discoloration, and what's known as terry nails, characterized by mostly white nail beds with just a thin reddish-brown strip near the tip. One revealing medical study found that 68% of patients with known liver diseases like hepatitis and cirrhosis had multiple nail changes, while only 35% of the control group had any. So consistent nail changes definitely warrant having your liver evaluated by a doctor. Last but not least, few people realize that imbalanced hormone production stemming from liver damage or disease in both men and women can directly contribute to plummeting sex drive and function over time. Everything from advancing non-alcoholic fatty liver disease and hepatitis to excessive alcohol consumption over many years throws key liver enzymes out of whack. And these liver enzymes play a vital role in regulating sex hormone levels. When damaged, the liver struggles to properly metabolize and regulate hormones like testosterone, estrogen, and others. The consequence of this is loss of libido, infertility, and sadly for many men, erectile dysfunction. So if your love life seems to suddenly be fizzling with your liver possibly at fault, it may provide the motivation needed to get a full health workup done. If fishy, almost rotten-smelling, bad breath emerges for months on end and persists, no matter what oral hygiene steps you try, pay close attention as science says you very likely have advancing liver damage or disease that requires further evaluation and treatment. This distinct mouth odor is clinically known as fetor hepaticus. And while everyday bad breath triggered by certain pungent foods or bacteria on your teeth differs person to person, fetor hepaticus sufferers describe their chronic breath odor as an overpowering hybrid smell of dead fish, sour garbage, and rotten eggs, usually too intense to mask even with gum, mints, or mouthwash long-term. Be aware that fetor hepaticus only arises once higher levels of toxins and sulfur waste products like mercaptans start building up internally due to the liver. No longer adequately filtering blood and formerly silent disease progresses unchecked for years. So unlike standard halitosis, chronic rotten-smelling breath must be treated as a serious symptom of much larger health issues in urgent need of diagnosis and care from a doctor. So there you have it, the top 14 vital symptoms every person should know about that can reliably signal your vulnerable liver may be facing increasing damage or disease brewing silently in the background. As I hope this video illustrated, if you start noticing one or more of these more serious symptoms persist for weeks on end, or seem to be getting progressively worse over time, listen to your body and seek qualified medical advice. Getting the right blood tests and scans to check on your liver health status is critical, and in almost all cases, addressing emerging liver issues early on gives you profoundly better odds of reversing further decline with swift treatment intervention before it's too late. Beyond getting checked out by a doctor you trust, other liver protective steps you can take right now include limiting alcohol consumption, processed foods, and environmental toxin exposures that tax your liver daily. I invite you to subscribe and comment if you found this educational liver health video helpful or would enjoy seeing more content in the future. Thanks so much for watching, and I wish you the best life has to offer.